In-depth journalism in the Memphis community, the Daily Memphian is of Memphis, not just in Memphis, and seeks to tell the stories of this city. TheDailyMemphian.com. Truth in place.
Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
The future of Regional One, tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian. Thanks for joining us. I am joined tonight by Dr. Reginald Coopwood, CEO of Regional One Health. Thanks for being here again.
Thank you for having me.
Absolutely. Along with Bill Dries, reporter with the Daily Memphian. We'll talk a lot about the future of Regional One and the present, but the news now is that you bought some land and made some news with that. But give us the quick snapshot of this, 16 acres of $25 million purchase near the medical district. Why that land and what comes next, and then we'll break all that down in much more detail.
Well, our original plan was to build on our current site, and which was going to require tearing down some buildings, building up half of it, tearing down some more buildings, and building up the second half, which was going to be a long project, which was going to be expensive, a little bit more expensive. It was going to be very disruptive to patient care. So our consultants that are helping us with the project management said, is there any land nearby, greenfield, brownfield, that we could consider putting the whole hospital on? And so that's when we talked with our brokers at Universal Real Estate, commercial real estate, and they came back and said, what about the commercial pill site? And we went and looked at it and saw that it was a viable potential for this project, having enough footprint for building a hospital in one spot. And
just to orient people, the commercial building is on Union.
Correct.
There is a bunch of land back there. The press was back there. And then there were some other parcels that, again, has now been assembled into this 16 acres. That building was, and there's been lots of questions about this, and I think we talked about it, Bill, and I did on a recent roundtable, that it was retrofitted after the CAA had sold it, and during COVID, it was retrofitted $60 million from the Corps of Engineers during COVID to be a kind of, not so much a hospital, but maybe an overflow facility for people who are sick.
Correct.
That people have asked, well, can that be taken advantage of for this new Regional One?
So no, it can't. They repurposed, I think it was the office building part of the property, and it was really kind of a big MASH hospital, and it does not have current hospital codes for anything that we could use.
A couple of quick questions I'll get Bill in. Just the overall cost of this, you've talked about as much as $1 billion over as much as 10 years. Is that still the rough sticker price?
So I think the $1 billion is still a good number. Our consultants are right now programming what would go in it, kind of programming. Then we will identify architects and engineers that will do the design, and then we'll have a good number of what the project will be. We used to say, back of a napkin, it takes $1 million a bed to build a hospital, and that's just... That for a long time was the number we used. That number is about $2.5 million a bed, just because of the increased cost of labor, increased cost of goods. That's really happened since COVID.
And that 10-year timeline still roughly?
We feel that we will be able to take 2 or 3 years off by being able to build it as a single entity.
Yeah. What happens to the old buildings?
Well, the old buildings are owned by the county.
Okay.
Our recommendation will be that they come down and create some type of green space for the county to decide what then to do next. The last thing we want is another empty building with broken windows and graffiti.
Yeah. Let me bring in Bill. We'll get through some more details.
And Dr. Coopwood, I believe at this point, you don't know what is going to go where in the footprint. That's
correct.
That's still being determined.
Correct.
The building was used as a place where printing took place, and as a result of that, there were some questions about environmental concerns.
So our brokers engaged a environmental firm. Tioga here has an office here in Memphis. They've done extensive phase 1 and phase 2 environmental test. That has been sent to the state. TDEC will be the entity that will ultimately say if there's anything environmentally that will prevent us from building a hospital. The standards, I understand, has to get to a residential standard, and they feel that what we've seen so far is no difference what has been seen in that part of town, in the medical district, all along there where there was car lots and all. So we have not run into anything that gives us any pause that we'll be able to successfully put a hospital there.
What specifically triggered you and the consultants to look at a new site for this?
It was really probably the difficulty was going to be, and we had a very high level engagement that gave us a really high level possibility of where there was a large UT building right there on the corner of Madison and Dunlap, and that was going to come down, and we could theoretically build phase 1. Logistically, everyone knows that our number one service that we provide for this community, and the community depends on us, is our trauma center. And it was going to be difficult to put the trauma center in phase 1, and so here you have a 5 or 6 year build of half of the hospital that more than likely would have had women's services or NICU. And then when that's complete, you would tear down where our women's services are and build phase 2, and there's the trauma center. So we were looking at 7-8 years of really having the ability to put in a new trauma center, which is so severely needed in this community. And this new site gives us the opportunity to program and design so that our core services that we provide can be in the very first phases of the build.
And I would imagine there are things in the new design that you can just do because it's a blank slate versus kind of the dance of, okay, we're doing this over there and then we're going to come for this part.
Absolutely. And that's one of the things that excited our consultants and excited us is the ability to do that. And our brokers, Daryl Cobbins, who leads that, said the possibility or probability of cobbling that many of acres together in kind of the medical district was improbable, but we were, and we're still identifying properties that are nearby to be able to include in this whole piece of property that we would want to build a hospital.
Right, and there are still 4 parcels that the County Commission, I believe, has on their agenda for a week after we're taping this.
Yeah, I should note that we're taping this, and this is airing a week later, so some things may have developed in the week before this airs because of my schedule, but go ahead, Bill.
So what happens to what's currently Regional One's campus?
We don't know, and I say that because this is 4 weeks into knowing that we were probably going to move. But as I said, none of the buildings except our outpatient center and area where our burn center are seismically appropriate. So I would think that the buildings that are built in 1950 and those on stilts probably need to come down for safety reasons, come down to reduce blight in the area. Whether or not we move our outpatient facility and the facility where our burn center is are decisions that we'll have to make going forward.
Mm-hmm. Let's talk about, again, the $1 billion round number that you've talked about. The County Commission, I believe it was last year, committed to $350 million over 10 years. You've been on the show before. You've been up at the state for the last few years, lobbying for another $400 to $500 million. You were hoping that would come out in the initial budget that the governor put forward. It wasn't in there, but There's a lot more that often gets added into a supplemental budget. How do you feel about the prospect of the state money, and then what are other sources, if any, for this plan? So
I have to remain encouraged until I find out there's nothing there in the supplemental budget. So I'm encouraged that my meeting with Governor Lee and our meetings with his staff over the summer into the fall were fruitful, and that they'll still try to put some significant dollars in the supplemental budget. You know, there will be a finite amount of money with an infinite amount of projects, and we are just hopeful that our project will rise to the top to where they will consider it. The other thing is we will, and our foundation is gearing up for a philanthropic campaign, a comprehensive capital campaign to raise funds for part of those dollars. That should probably be kicked off in the next couple months, and the community will know what that number is. And then we will continue to look for corporate sources to want to participate, as well as if we have to, and our financial projections allow, to the consideration of going to the market for some money.
So raising some debt.
Correct.
Yeah. Is it all or nothing? I mean, or you've got a certain amount committed, and you can do certain things over on the new site and leave other services at the existing facility, or is it we got to do everything over there, or we can't build?
So our consultants, what I asked them to do is give us a programmed full everything on the site that has a cost to it, X. And then what we'll be able to do is, if we have half of X dollars to build it, how do we stage it in such a way? So if this is going to be a 5 to 7 year process, it still gives us 5 to 7 years to identify further funds to be able to fund the second.
But that is possible, if not ideal, to have certain services provided over on a new, half a mile away kind of facility, and then just keep.
Absolutely.
Okay. The Regional 1 is owned by the county. Let's get in the weeds here for a second. Is it a separate entity, or is it a division of county government?
So the assets are owned by the county. Shelby County Healthcare Corporation, which is the 501c3 that is over Regional 1 Health, the DBA, Regional 1 Health is a DBA for Shelby County Healthcare Corporation, is a standalone 501c3 that back in the 80s was set up to manage the county's assets for them, run a hospital, as long as it provides care for the county's prisoners and indigent population.
And one more question, again in the weeds here, it's a brutal business, right? Hospitals just generally are a really difficult business. Healthcare is a really difficult business. We circle back to some of those factors if we have time. But on a given year, obviously take COVID out, does Regional 1, it's a nonprofit, but does it have a net surplus? Does it have a net loss that you then have to go and backfill that money? I mean, what are the round number kind of economics of a normal year, taking COVID out, normal year for Regional 1?
So for a normal year, so I've been in this position for 15 years. And so this is our 16th budget that we've done. For the 15 years that we've operated this hospital, we have cash flow positive, meaning when you look at our bottom line at the end of the year, and it is the loss. So we might have lost $10 million, but in the budget there's $18 million of depreciation, which is a non-cash item. So we have cash flowed positive for the last 15.
Including COVID.
Including COVID, but the asterisk there is we got some COVID funds in order to help offset the excess costs.
All right, we'll come back to Bill here. We're midway through the show.
All right. The other thing that's been discussed is the idea of the state, through the University of Tennessee, becoming a co-owner of Regional 1, in effect, with an academic medical campus. Is that still on for this?
So that's my preference, because I believe that this community deserves a true academic medical center. We have a medical school here that's been here over 100 years. and the level of care, the type of physicians that you can recruit to that kind of environment is something this community leaves. There are people in our community who leave Memphis for care because they feel they can't get it in this community, and I think that's a shame that we, as a healthcare system broadly, aren't providing all those aspects of care that are available. I grew up in Nashville. Vanderbilt University Medical Center was that academic medical center. It did not put any of the other hospitals out of business. But when I had a tough case that I might have been technically able to do, but where's the best place for that patient to be, I would transfer them to Vanderbilt University Medical Center, where the physicians, nurses, technicians, and all were available to take care of that patient. We don't have that here, and I think that's part of the vision. And if the state puts in the kind of money that we've talked about, then we would probably work to recreate a new kind of governance/ownership where the state and the county share in that, because the dollars have come from both entities.
If that happens, is the hospital built to accommodate that physically, or is there a different plan if there's not a partnership with UT?
So the hospital won't necessarily change from a clinical space. There may be, if we're looking to go to an academic medical center, there may be more research buildings that may need to be in and around the footprint. There may be, we train over 200 residents right now for the University of Tennessee, so we're their primary clinical site for their training of their medical students and their residents. And so that won't go away just because we don't have an official academic medical center or a co-ownership. But we want to be able to see if we can enhance that with the new relationship going forward.
Right, because those 200 students who are at the hospital now, it seems that with a medical academic center, that there's more of a two-way street in terms of patient care.
Absolutely.
As well.
Absolutely.
The academic aspects you just talked about, would that be over and above the billion, or the billion? Does that $1 billion, and I know it's a rough number, but does that $1 billion contemplate this partnership that you just described? So yes. So the billion is really a number, a good number that we know that construction costs would be. There's still FF&E, where we still have to buy CT scans, MRIs, and all that expensive medical equipment. So it's another couple hundred. Which all could change if you've got this really tight partnership that you want.
Absolutely.
We were with 8 Minutes and Show. We were talking recently on a roundtable about highlighting some real not great government entities right now, which include MATA, and we were talking a lot about the situation with the Memphis Shelby County School Board. I'm not going to ask you about those two entities, and I'm sure you're too smart to want to comment on those.
Thank you.
But it came up in that conversation that 15 years ago, before you were here, the Med, as it was known then, was one of those headlines in the local paper, and then the CA, that of a failing entity and an entity that was not doing well, and is it going to make it, and what's going to happen? And so when you look back, you just talked about you've been cash flow positive, including through COVID. Even with that money, that's still not all hospitals were necessarily. What was, for those who don't remember, what was the state of the Med when you got there, and what did you do to change it to be the viable institution it is now, even if it is an aging facility and so on and so forth?
Wow. So it's doing and handling business as business should be done. Building a team of individuals who are focused on the success, not only on the financial success, but the clinical success of the organization, the quality, the patient experience. We've focused on all of that for these past 15 years. The statement that says if you don't plan, you plan to fail, or whatever that is. I mean, they weren't doing budgets at the beginning of the fiscal year, and so there's just no way you can be successful if you don't have a good plan going into the fiscal year. So a lot of those things were just putting in sound business practices with the money that was available to us, and putting together a team that was aligned for the success of the organization.
And as I remember it too, is as you had success in turning the ship, you had more success. People were more willing to put some more money in. That progress beget confidence of funders, be that government or philanthropy. Is that a fair thing as well, or am I making that up?
So, yes, our foundation has become more successful as we've gotten out of the newspaper of a failing institution. The other thing is, when I came to town, the med was strictly for trauma and people with no insurance. So the community was clear that if I have insurance, I don't need to go to the med. And so we said we have to change that dynamic and that understanding in the community. And so we've built services, we've changed our quality, we remodeled the facility that we have, where our percent of uninsured was in the mid-30s%, and the amount of insured patients was a very small fraction of those who came through trauma. But over this period of time, we've changed that dynamic, not by pushing out the uninsured, but by creating the services that those with insurance and with choice would choose Regional One Health. That also improves the financials and bottom line of the organization.
Bill?
Healthcare here in the hospital business has been known to be competitive at times. Yeah. But I often wonder, when I hear some tremors from that, about what would be the impact on places like Baptist and Methodist if Regional One wasn't here, on all of the other hospitals.
You just take trauma. It would be, we have over 13 to 14,000 trauma patients that come through our trauma center. Over 6,000 of them are admitted. The majority of those are admitted are extremely sick and require intensive medical care. We have 4 operating rooms that are staffed and open 24 hours a day. That would have to be absorbed by these other institutions they're fine institutions, but they're not set up to take on that level of capacity and trauma. So the great outcomes that our trauma surgeons, our trauma nurses do on a daily basis would be impacted if you just all of a sudden sent every car wreck to every other hospital. And it's only because they're not set up to do it, not because they're bad hospitals. Mm-hmm. I have nothing bad to say about the other hospitals.
Right.
And it would impact elective care, because now all your ORs are tied up doing emergency stuff, and so it affects elective care. So those individuals who are going for elective care would have to wait. Those kind of things.
And we really got a good look at some of those problems during COVID.
We did.
And it wasn't pretty.
It wasn't.
With a couple of minutes left here, we can do a whole show on some of these things. Talk about the uninsured. What is the percent uninsured now?
We're around 18%.
From that 30+%.
But it's not less people. It's just a less percentage.
Less percentage. There was some talk of, Tennessee never expanded Medicaid when Obamacare came along. Mississippi did in the last couple of years.
Arkansas.
Arkansas did. There's been noise about Mississippi. I think they got through the House, not the Senate, or something like that. It's a whole new world at the federal level, but at the state level, you spend a lot of time there. Is that one of those things you're also optimistic until you're not, or does it seem unlikely?
It's one of those things we're optimistic about every year, and it hasn't come to fruition.
New administration, and without being political, just the reality of a lot of change, and there's a lot of federal money that goes to St. Jude, certainly, I think UTHSC. I can't remember if Regional One is on that list in terms of federal grants you guys get, in terms of research.
We get some, but not as much as.
Do you see changes from the federal level that there's talk of Medicaid cuts? Again, not the Medicaid expansion, just basic Medicaid. What do you see, without being political, from the federal government right now?
We see uncertainty, and the areas that they've gone into, they haven't really gotten into HHS, Health and Human Services Division, which manages Medicare and Medicaid. If there's significant cutting there of funding through Medicaid services for states, it will have a drastic and dramatic impact if the exchanges are underfunded and we lose people who have insurance through the exchanges.
Those are the ACA, Obamacare
Correct.
exchanges where people can get insurance not through an employer.
Those are the uncertainties because we don't know if they're going to go through there with a scalpel or a chainsaw.
Yeah. What off the cuff, what percentage of your patients are on Medicare?
Right now, we're almost at 30% on Medicare.
And then
another 30% or so, TennCare, and then insurance.
You bought some land recently, in the midst of buying some land. Right. County Commission has approved that funding. There's about 25 acres, 16 acres, $25 million. The old commercial appeal building and some surrounding parcels, all of which the notion is to tear that down and build a new Regional 1 over the next 7 years.
Correct.
You'll tell me when I get something wrong. You've talked for a couple of years now, you've been trying to get to $1 billion towards a whole new facility, which was going to be on the site of the existing facility. So 2 questions. Why build elsewhere? And where are you in terms of the fundraising and the commitments towards that $1 billion?
Well, to your first question, the opportunity to build on, I've learned, is a brownfield, is to be able to have more flexibility in how the facility is designed and what comes first and what comes second. When we were on our own campus, we were determined only by what we tore down and what we could put in the first phase and what we could put in the second phase. And as it stood, without any real granular programming, it was looking like our trauma center was going to be 7 or 8 years down the road because logistically we couldn't get it in phase 1. And so this gives us more flexibility to design a medical center, and if we don't have all of the funding at the front end, we can at least build the key things that this community depends on. And
in terms of funding, the County Commission, I think it was last year, committed $350 million over 10 years. You're looking to get, I think it's as much as $400 million from the state. Wasn't in the original budget that the governor generally presents, but the session then goes on, and more projects are generally introduced. So you're hoping to be in that, what they call the supplemental budget at the end of the session.
For the past 2 weeks, I've been in Nashville more than I've been in Memphis.
Yeah, I bet you have.
Talking to the Shelby County delegation, West Tennessee delegation, and the governor's office to see if we can't get funding with the supplemental budget.
And before we go to Bill Dries, we've talked to you about this before. People always bring up Regional 1 serves other states. What about funding in other states towards this big project?
We've reached out to each of the governor's office, Governor Tate and Governor Huckabee, and really haven't had good traction. We serve as their level 1 trauma centers for both of those states, but I don't think they have a good feeling of an obligation to help with the capital projects. They do give us funding for the trauma, being in their trauma network, as well as part of their Medicaid program, but haven't convinced them yet to participate in the capital. All
right, we'll bring in Bill Dries from the Daily Memphian.
The County Mayor Lee Harris has talked about a plan B here, and that is that the county, instead of doing $350 million, does $500 million, which I think is maybe the first phase and then some.
Correct.
So is that acceptable?
Well, it's acceptable to get to the $500 million known financing that's over 10 years, allows us to start the programming, start identifying architecture and engineering firms and construction firms, and it gives us the enough funds that if we have to do it in phases, even on the new property, that we can get a good phase 1 up and to be able to really put those areas that are core to what this community depends on us for.
Right. And phase 1 is the trauma.
That would be our most important asset that we would want to get into that phase 1.
Okay.
Briefly, part of this vision, it isn't a necessary part of what you're talking about with this expansion and this new facility, but you'd love to have a much tighter relationship with UTHSC and academic training, academic medical center. Talk about what that means and what that would bring to the community.
And so if we can, so we have a good transactional relationship with UT. We train their residents and fellows all of our medical staff are UT physicians. We would like to get to a point where we're more strategically aligned in building an academic medical center that focuses on doing clinical research, enhanced education, as well as clinical care. That's my desire. It obviously has to be shared by the university. But I think this community deserves that. I think this is something that's been missing in this community over the years, and it deserves it.
I have so many more questions, but I can only give you 20 seconds to answer, and these are complicated things. So I think we will leave it there. We will continue to cover this, obviously, in the Daily Memphian as you go through the legislative session and so on. We really appreciate having you here again. Bill, thank you as well. In the coming weeks, we've got Police Director C.J. Davis. We've got folks from the Memphis-Shelby County School Board, as I mentioned, talking about some of the turmoil that's been going on there. And if you've missed any recent episodes, we had folks from the Republican and Democratic parties locally. We had county commissioners, city council, Mayor Harris and Judge Sugarman. All that you can get at WKNO.org, the Daily Memphian, or go to YouTube and search for Behind the Headlines. Thanks very much. We'll see you next week.